I stopped taking my Adderall in the first trimester only to almost lose my job as a result. I was super depressed and felt totally helpless. My high risk OB recommended I get back on it at 16 weeks, and it's been a game changer for work and my mood.
I'm Dr. Nichelle Haynes,
I'm Dr. Kristin Lasseter.
and this channel is Medical Mamas. We give you the real deal information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like around pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
Based in science. Okay, so let's first set the groundwork with maybe just some information about ADHD in women in general.
Yeah, because ADHD in women can be so much different than ADHD in men. And I think classically, when we think of ADHD, especially if we're thinking of like a little kid, it's
Mm-hmm.
someone who's like crazy, running around everywhere.
Mm-hmm.
And that's just not women naturally.
Right. So the data supports that women tend to have more internalized symptoms. So what you're talking about there is more external symptoms that people can see from the outside, right? They're like bouncing off the walls, they're like interrupting, they're doing those kinds of things. But internal symptoms are things that people might not necessarily see from the outside. So that naturally leads to women or girls being diagnosed later than boys.
Or being missed completely
Mm-hmm.
and never getting diagnosed until later in life into an adulthood.
Mm-hmm. I can't tell you the number of times I've had someone come to me, after having a child or two and just getting to the point where the coping skills that they use to manage their ADHD no longer work because they have so much else going on in their lives. And that just means like the symptoms that they were having got to a point where they couldn't manage anymore without medication.
Yeah, and I had a really great chat with Dr. Pulaski, who's one of the leading researchers on mom brain and, you know, brain changes that can happen during and after pregnancy.
Mm-hmm.
And one of the things we kind of also touched on is that moms today are balancing so much more
Mm-hmm.
than we used to. Now we have careers, but we're also managing the house. But then we have a baby, and we're also supposed to be the primary caretaker of the baby. And I think in someone who's struggling with ADHD, they can kind of manage those things by themselves, especially like higher functioning, smart women.
Mm-hmm.
But then you pile all of them together and it just doesn't become feasible.
Right, right. We could do a whole video on just the expectations for women or for moms in general. It's ridiculous. There's a lot that we could talk about there.
Hmm.
But it really just shows how some women with ADHD are able to like manage things with, lists or whatever coping skills they use. And then when a kid's screaming at you, like the list just kind of goes out the window.
Yeah, and there's research supporting too that hormone changes in women play a big role in ADHD symptoms and the severity of them. And we see like in adolescent girls that when they're younger, they're not as impaired by their symptoms, and then as they get older and hit puberty, those symptoms become more impairing. So
Mhm.
kind of extrapolating that to motherhood, like it would make sense that like once you're pregnant and postpartum,
Mhm.
that kind of accentuates those symptoms. We also know that women who are more sensitive to hormones in their brain, also that sensitivity increases as you age. Like
Mhm.
after having a baby, that becomes
Mhm.
more of an issue too. So it makes sense.
We went recently to a conference, and one of the researchers was presenting new data on this exact topic. And I thought it was so fascinating. It was so interesting the way that she was performing her studies and gathering the information. And the information that she found was just so like validating for what I see in my patients and even, my own struggles, right? Like if you're a woman and you have regular cycles or you have cycles, you kind of know what it is to like have a little bit of the crankies right before you start your period,
Mhm.
or you kind of know like, ugh, I just don't feel good, and then you start your period the next day, or something like that. Like you've had something along those lines, right? Where you can imagine what it would be like for someone who is, impaired by a psychiatric illness like ADHD or
Mhm.
depression or anxiety, and sort of imagine what that's like for people who are more sensitive to those hormone changes.
Yeah.
Yeah. Yeah, it makes you feel like you're a little, like, wacky, like, how can I rely on my brain? These kinds of things, like, it's
Yes.
just so yeah, it's a lot
Yeah, and
to
so hormones have real effects on our brain, and
mhm.
yeah, that's been proven by science.
Right, and there is some data to support that women are more impaired in certain aspects of ADHD than men. And maybe that's one of the contributing factors. So, we have these big hormone shifts, and we know that hormones affect our brain. We don't understand exactly how or, what the mechanism that is there, but, maybe that's one of the reasons why women are more impaired in some aspects.
Yeah, and research has shown that women with ADHD compared to men with ADHD are at higher risk for substance use. They're at
Yes.
higher risk for depression or
hmm
managing depression.
hmm I I talk to my patients a lot about how ADHD and anxiety are besties and they're like almost always
Mhm.
going to hang out together. Because what I see with my patients is that with ADHD, especially someone who is aware, right? They are aware that they forget things, or they are
Mhm.
aware that they're like struggle with task completion. They are aware of the ways in which they struggle. And so they develop these skills that we've talked about, right? They develop these skills where they deal with like a lot of checking behaviors, or they're kind of like consistently thinking about what did I forget or what, and that just
Or they,
leads down this anxiety path. They're like
yeah,
always hang out together.
or they have things like very organized and controlled.
hmm
And kind of control is a big thing too, because if
hmm
it goes outside of the routine or outside of what's
hmm
regular, then they forget or things get missed.
Right. Right. There's just so many nuances here. I mean, I could talk about it all day. Okay, so, in this vein, in this context, right, we're talking about the ways in which ADHD affects women. We know the substance use issue, that people just generally with ADHD are at varying degrees higher risk for having a car accident, right? 1 to 2 times, depends on, who exactly the research, all of these things, but they are definitely at higher risk for car accidents.
They're also just not as functional. They can't function in their everyday life as well as when they
hmm
can, for example, when they're treated.
hmm
And so, one of the risks that they've found in one study was that women with untreated ADHD, especially in pregnancy, if they had like other children in the house, the family function was also poorer in women who had ADHD versus women who had treated ADHD, which I
hmm
thought was
hmm
interesting.
Right, right. And I actually had a patient talk to me about this yesterday about how her kids can tell if she is taking her medications or not. And, she can obviously tell. And like the house looks different. The functioning of their home is different. Yeah. So I think the reason we talk about these things is it's really important to know the context, right? We talk a lot, almost every single video, about risk versus benefit, risk, having the full information before we are making a decision about medications, whether they're appropriate or not.
Yeah, I just yesterday actually went and talked to a fertility clinic here in Texas about medications and their effects on fertility and miscarriage. And, really kind of again focusing on that risk
Mhm.
discussion of what are the risks of untreated mental illness, what are the risks of the medication, and ADHD and the treatment for ADHD is no different.
Right. How did the talk go?
It went really well.
Yeah, I saw some pictures. It looked like it went really, really well.
Yeah, it was
Good.
fun.
Great. It's so fun to like provide that education and
It
like hear the
is.
feedback and stuff like that. So
Yeah,
let us know here also in the comments. It's really fun for us to get your comments and to hear from you what things you want to learn about. And, if you have questions about any of the things that we say, please like comment because we're happy to have a discussion with you and, maybe provide some additional information.
Well, and I think it's really helpful for other people, like in this community. I
Hmm.
think sharing your story of what it's been like for you,
Hmm.
if you took ADHD medication treatment in pregnancy or postpartum, or how that has helped you or not helped you. I mean,
Hmm.
hearing stories of other women and their experiences can be
Hmm.
really validating and helpful
Hmm.
for other women, because I think it's another thing we just don't talk about enough, and so people feel a lot of shame and guilt around it
Oh,
and feel like they're alone in it. But trust me, we see patients every day
right,
who are dealing with these things, and you're not alone. And all of the things that you go through are things that other women are going through too.
right, right. I will say 99.9% of the things that I hear from patients are not unique to them,
Hmm.
right?
Yeah,
That there's like just some general things that we go through as women, there's general things that we go through as moms, as working humans, right? Like we can always find some common ground with someone else, especially related to, symptoms, functioning, those kinds of things. Like not to be like silly, but you're not unique in that situation, right? Like
that's a downer. No, I'm
no,
kidding.
no, you're a wonderful, amazing human, but, like, you share these qualities with other people, and I think that connection's really sweet.
Yeah.
Yeah.
So, kind of getting into this risk discussion, like
Mhm,
if we're talking about, and we've kind of touched on this, but
mhm,
just to kind of put it all together and
mhm.
summarize it, if we're talking about the risks of untreated ADHD in pregnancy, I think one thing that is really important to point out is that the research on ADHD in
Oh,
pregnancy
yes.
is not there. It's like there
Right.
are a few studies, and these studies are like of a few people, but we really don't have good research. Like we're always saying, poor women, like we just get the
Mhm,
short end of the stick when it comes to science research. But
mhm.
we don't have any research on ADHD in pregnancy, or not any, but not enough.
No, there's definitely not enough. And another caveat that sort of brings a lot into this discussion is that a lot of the data around stimulants, specifically during pregnancy, is kind of mixed with data for illicit stimulant use, right? So
Yeah.
methamphetamine, or using the stimulants outside of a psychiatric treatment. So that also adds in additional variables, right? Because substance use, there's a lot of overlap at times with other variables, right? High stress, cigarette use, low socioeconomic status,
Or
other
those
things.
substances might be mixed with other contaminants. Like if you're
Yeah, you have
getting
no
them
idea.
illegally, they're not necessarily, obviously not FDA regulated. So we
Right.
don't know what else is in those.
Right. So that is just another thing that colors this entire conversation is that some of the data that we have is mixed ADHD treatment and illicit substance use. And those are very different from each other
Yeah, they're
in
two
a practical
totally
sense.
different populations.
Right.
And I would say the majority of research on stimulants is in women who were abusing the methamphetamines. And so it's not even like the research we have on medicinal stimulant use is even
Even
smaller.
smaller.
Yeah.
Yes. Yes. So the data that we have, with the overlap of substance use and ADHD treatment is largely reassuring. Of course, there are some studies that are less reassuring, right? But even with all of these confounding variables, cigarette use, housing insecurity, whatever the thing might be overlapping, the data is still largely reassuring.
Yeah, I mean, I think it's for looking at women who were abusing
Mhm,
methamphetamines, there wasn't an increased risk of malformations, major malformations,
mhm,
which is one of the big things that a lot of people worry about
mhm.
in exposing their baby to different things in pregnancy. But
Right.
I think kind of going back to like the risk of untreated ADHD in pregnancy,
Yes.
we know that when we're pregnant, I'm sure we those of us who have been pregnant, like your brain's just not working the way that it normally does. There's like this, you got pregnancy brain. Like you walk into a room and you're like, I don't even
How was I
remember
here?
what I was, why am I even in this place? So you can imagine that in women who have ADHD, that becomes exponentially harder for
Yes.
them. And so take the data that we have about just ADHD in general, and that there's an increased risk of car accidents, there's an increased risk of depression, there's an increased risk of substance use. It's harder for them, it's more impairing for them than it is for men. Take that data, and you can just imagine in pregnancy
Mhm.
it's probably worse, or it's at least still there. I don't think it
Right. No,
disappears.
I mean, I have no doubt that it's worse in pregnancy. I mean, there's so many things happening that like it is almost impossible that there's not some impact.
Yeah. And so I think that's also a individual discussion for somebody is how bad is your ADHD when you're not treating it?
Mhm.
Are you able to function at work? Are you able to function at home?
Mhm.
Are you able to
Take
like
care of yourself.
safely drive a car or
Oh,
safely, cook dinner for your family? Or are you going to forget that the stove's on and get distracted by
uh-huh.
your toddler running around and then the kitchen gets caught on fire?
Yeah, I actually have a patient who was pregnant and had, a little bit older kid who still required safety car seat, booster seat kind of thing. And one time forgot to buckle her kid up until she was like outside of the driveway and was like, oh, right. So, we see that it's not just, like being a little flighty or forgetting to do tasks at work. These are like really big safety issues that can come up. So it really is an important individual discussion about if those kinds of things are part of someone's symptomatology to decide
Right,
whether medication would be better for
right.
them or not. Yeah.
Yeah. So when we're balancing the discussion of risks of medications, it's important to bring in that risk discussion about ADHD. And so kind of getting into the risks of medications, like we've talked about how most of the research is on people who are abusing methamphetamines and not necessarily on people who are taking medicinal Adderall or amphetamines
Hmm.
that's actually been regulated by the FDA and is prescribed. But the data that we do have, the small amount of data that we do have, is actually kind of mixed on a lot
Hmm.
of
Hmm.
the things.
Yeah. Specifically talking about amphetamines in pregnancy. Like we said, the data is mixed. There are some studies that will show one thing and some studies that will show a different thing. So we'll present, the information that we do have. I think consistently across the board that we're not seeing an increased risk of malformations.
Yeah, and like we talked about, even with people who are abusing methamphetamines, we don't see an increased risk of major malformations, which I think is reassuring and helpful for a lot of people who might need it in that first trimester when
Mhm.
taking medications can increase that risk depending on the medication.
Right, right. Especially, just organ formation, that kind of thing. Yeah.
Hmm.
Okay, and then the other thing that we worry about things like preterm birth, low birth weight, NICU admission, neonatal adaptation, other things related to the outcome of the pregnancy itself, right? So I think
Yeah.
consistently we do not see an increased risk of preterm birth or low birth weight.
I think that's been pretty mixed. Like, there's been some studies that have shown that there is an increased risk, even when you're looking at confounding variables. So, variables that might be mixing in with the data to make that more likely. Even if you take into account those variables, for some studies, they do show an increased risk. But then for other studies, almost as equally, they don't. So
Right.
I think that's really mixed, and that's one of those things that we need more research on to be
Mhm.
able to confidently say whether it does or does not increase the risk of preterm birth.
Or alternatively, for whom does it increase the risk and for whom does it not increase the risk? I think that's
Yeah.
a better question, right? Because if we're seeing mixed studies, is it people who are on XYZ dose? Is it people who take it during, a certain period of formation for the baby? Or is it,
People who are also taking other medications
yeah,
or
people with
people
really
who,
severe illness, right?
yes,
Is it,
severe ADHD.
so there, I think the question isn't does it or does it not? I think the question is for who and for whom does it not? Or however you say that in the correct grammatical way.
In the English.
Whatever.
And then, like neonatal adaptation syndrome or baby kind of struggling or, struggling with adapting being born, like that's also pretty mixed in that there's some research studies that show maybe it does. I think there maybe was like one that showed it does. And then there were, I think, a couple that showed it didn't. So that one's mixed.
I think that one is likely due to the confounding variables of the other things that happens with substance use.
Yeah, that
Yeah,
makes sense.
probably, right?
Yeah.
I mean, because you were telling me about one of the studies that you were reading about, like a lot of the confounding variables were other psychiatric medications, opioids,
Yeah, they're more likely
so
to
smoking
be,
cigarettes, other things.
yeah, more likely to be on prescription opioids,
Hmm.
which I thought was interesting for that particular study, not just women being treated for ADHD in general.
Right, right. So there's a lot of things to kind of look at and think about, think about there. But one thing I, always am really sure to talk about is hypertensive disorder, or like, preeclampsia or increased blood pressure, those kinds of things that we do know stimulants are stimulating, right? And so that can stimulate people to have higher blood pressure. So if someone is already higher risk, for having high blood pressure or preeclampsia, that may mean, we include that or we always include that in the conversation, right? Like
Yeah.
we maybe want to monitor a little closely. We may want to use a smaller dose or divide the dose or, however we can to reduce that risk and make sure that we're not having someone really hypertensive or have high blood pressure in
Yeah.
pregnancy.
Or making sure that you're, talking, for me, I'm like talking with the OB
Hmm.
about like,
Hmm.
hey, they're on stimulants. Let's make sure we're monitoring. I mean, obviously, OBs are already monitoring
Yeah.
blood pressure every time you go in for your OB visit. But that's something to kind of keep the conversation open about and deciding, okay, is it that the hypertension is getting bad and can we decrease the medication? Does that help? But we do see a correlation with taking stimulants and hypertension in general,
Hmm.
but in pregnancy also for people who didn't have hypertension before, then they're at increased risk of hypertensive disorder of pregnancy.
Right. So an important point there.
I
What
think
else?
other thing to comment on is that when we're prescribing for at least the way I was trained, when I'm prescribing a stimulant in pregnancy, ideally we want to use one that is shorter acting so
Hmm.
that it's not staying in the body as long and that we're using it only when needed.
Hmm.
So, of course, this varies depending on the person's issue and how their severity of their ADHD and when they're needing it. But, for
Hmm.
some of my patients, it's really just when they're at work or, if they're at home with the kids and having to, balance multiple things on the
Hmm. Hmm.
weekend and so being able to just kind of tailor their treatment to those specific times, like I think that helps reduce risk. I don't
Right.
know for sure, but that would be my assumption.
Right. And that's how I was trained as well, right? We're going to use the lowest effective dose. We're going to try to use the um, immediate release medication and use it as sparingly as possible. Try a dose decrease prior to pregnancy if possible. Those are some of like the nuances of prescribing,
Hmm.
in this field.
Yeah.
Yeah. So we obviously care about the health of the pregnancy, the health of the baby, but we also care about the outcome for the child who was exposed to ADHD medication, specifically Adderall, in pregnancy. And so the data that we do have around that shows that there's no increased risk for exposure to the medication for the child to have autism, ADHD, other neurodevelopmental disorders, growth,
Wait.
weight. Yeah, so the data around that is reassuring. But also to
Yeah.
remember that ADHD is one of the most heritable psychiatric illnesses. So
Hmm.
if mom has ADHD, the risk for their child across the board is going to be higher.
Yeah, but when they're looking at people who are already diagnosed with ADHD, the ones who took medications versus the ones who didn't, taking the medication didn't then exponentially increase that risk for
Right.
ADHD
Right.
or autism or other neurodevelopmental disorders. And then those kids, they looked at, I think, kids up until 2 years of age in terms of growth and weight were the same as babies who were not exposed to ADHD medications in pregnancy.
Right. Yes.
So I think that takes us back to the original question of, can you take Adderall in pregnancy?
So, of course, a nuanced answer is going to be the way we move through things here, as always. If it's the right choice for you,
Yeah, I
right?
think
There's no
it
reason to say you
depends.
cannot take Adderall during pregnancy unless that's the case for you. You're allergic or
Well,
something.
yeah. Well, yeah,
Right.
that.
Don't do that.
But also, I think that's like we talk about with other medications, a big red flag. If your doctor or prescriber
Oh, I
says,
know what you're going to say. Okay, sorry.
no, you cannot, you have to stop this medication if you become pregnant, and they didn't have a talk with you about the risks of your ADHD untreated versus the risks of the medication, like I think that's a red flag.
Oh, right. I think a physician or someone who is in healthcare just telling you blatantly like do or do not do this is always a red flag.
Yeah.
So our answer is nuanced. If the benefits of the medication outweigh the risks of the medication
For you in particular.
for you and your circumstances. So we don't say no. We just say if it's right for you.
Yeah.
So you can if it's right for you.
Yeah.
Yeah.
And you can kind of test it out too.
Right.
Like, as long as it's within the realm of being safe and, you're not going to harm yourself or your other children by not taking your medication, then maybe testing it out. Like, can I still function without
Mm,
this medication? And
mm,
hopefully, you know that before you ever got pregnant of kind of the severity of your ADHD.
right. Right. Yeah. And I think coming back to the very beginning when you were reading that quote from someone who shared their story with you, sometimes we don't know, right? Like
Yeah.
she stopped taking her medication and things fell apart at work.
Yeah. And she almost lost her job. So, yeah, I think it kind of has to be a flexible thing of just seeing what's right for you, and there's no definite yes or no answer to that question. Just like other things with medications and
Mhm.
pregnancy too.
Yeah, every pregnancy is different, every brain is different, every risk tolerance is different. So
Yeah.
depends on if it's right for you or not.
Yeah.
Yeah.
But share your experience in the comments. Like I would love to hear other people's experience and how it's been for
Mhm.
them or what their experience was like in pregnancy with ADHD. That always
Mhm.
fascinates me in general. So
Mhm.
even if you're not talking about medications, just let us know what your experience has been. We'd love to hear about it.
Yeah, thank you so much for being here. Please like, comment, subscribe. We'll see you soon.
Bye. And then we
Okay.
also know that in general, women who are more sensitive to hormones in their brain.
You got him. Thank you.
Thank you, Charlie.
Hey,
No.
all done.